So we'll just really start with some opening notes and reminders. And if this is your first time with us, please do put your name and where you're from in the chat. We're so glad that you could make it. And we're very fortunate to have the one and only ukulele playing amazing Marigrace Becker, who is going to talk to us today about community resources for dementia patients and their families, or people living with dementia and their families. And then there will be ample time for discussion. Next slide, please. So please name yourself as I requested, and mute when you're not sharing. We'd love to see your face if you can. So turn your camera on. If there's other folks in the same room, please list them in the chat as well. Next slide. Just a reminder, so there is CME for students, and if you staff and faculty, and if you are affiliated with the University of Washington, then you want to make sure that you send your University of Washington email address to this number, and then you should receive a response stating that your number has been updated. And then all you have to do to get CME is to text 8574 to that number. And then you'll get a response saying, thank you, we've recorded your attendance to our University of Washington Project Echo Dementia, or this DS2345 Dementia Echo. Next slide. For everyone else, don't worry, because we are tracking your attendance and you will get CME. And Sammy can follow up, reach out to her if you have any questions or need additional information. Thanks. Next slide. There are also a whole host of CME accredited other really wonderful echoes that are being offered currently. One on traumatic brain injury and behavioral health. There's an echo on psychiatry and addiction. There's also a telebehavioral health training series. That's the third Fridays. Next slide, please. These are all free and have CME. There's also a telephone consultation especially for people with complex pain regimens and high dose opioids. You see the number there. And then a telepain series. Next slide. And then there's the archived psychiatry grand rounds, really rich, wonderful talks available, and you can join also via Zoom as well. The series is in the link. Next slide. And please do bring your cases forward to us. We all learn together when there's a case presented. So, you know, as we've said on a number of occasions, there really isn't a case that is without learning, you know. So even if the case has been presented before, or if it's in your mind pretty simple, there's no case too simple or too complex. We can all learn together with cases. We don't have anything to disclose. Next slide, please. And I think that's it. And so without further ado, let's introduce, next slide, please. Here's our team. Here's our, we've provided 1,500 instructional hours. There's a lag here, it looks like. That's okay. Here's our hub team. You can see many of our smiling faces today. Some of us are traveling on vacation, celebrating birthdays and so forth. Next slide. We represent, you know, a number of health systems across Washington. And then, as you see here, we really are trying to include people from all corners of the state. Currently, there's 70 sites and 187 providers, and over 70% of our respondents say that they would implement a practice change based on the learning. So, and now, without further ado, please welcome Marigrace Becker to speak to us today about community resources for people living with dementia and their families. Thank you so much, Mary.
Thank you, Nancy. Thanks so much for that warm welcome. Really pleased to be here with you all. And thanks for being interested in spending your Friday afternoon learning more about community resources for people with dementia and their families. So as you heard, I work out of the UW Memory and Brain Wellness Center and manage our community programs for people with dementia, including our community center that's 2 years old now, the Memory Hub. And I'll share a little bit more about that today too. So I will go ahead and pull up my slides. Give me just a minute. Okay. So for some of this might feel a bit like a recap or review, but I'm hoping it can be a reinforcement of maybe a few of the resources you've heard about before in some of these Project Echo Dementia talks or elsewhere. And my hope is that you'll be able to, after the end of today, recognize, what are those common types of resources that may be available in your community for people with dementia and their families? What are the publicly available sources where people could go to find those resources? And how can you connect people to those sources? So how can you make those referrals? So pretty simple. I think we'll definitely be able to achieve these learning objectives today. And I'm just gonna barrel forward. So to kick things off to that point of, what all is out there, what all is commonly available in communities focused on resource for people with dementia and their families. And I'm listing some of the common types that you might find or that your patients and their families might find in your community. Things like memory loss information, like printed materials, educational talks, caregiving information, support groups for caregivers especially are quite common, adult day programs, options for in-home care, as well as supportive housing options for people, information about safety, staying safe at home with dementia, information around legal and financial planning or professionals that work on that with folks, advanced care planning information, and then social engagement. For example, memory cafe programs and other opportunities for people with dementia to connect with each other and stay engaged in their community. So this is just a snapshot of thinking through what all might you anticipate, expect, or hope for in terms of the resources that are there for folks with dementia in your communities. And it varies from community to community, but I think it's helpful just to have a sense of what are those common things out there. So where can you or your patients and families turn to access some of those resources? I decided to really keep this very focused on what are those, statewide agencies that provide those types of resources. And I'm going to cover talking briefly about the Alzheimer's Association, your local area agency on aging, the Dementia Action Collaborative, Dementia Seattle, and I did want to mention the Memory Hub and that we do aim to serve statewide. And then locally, you can I always recommend being a social worker myself, working with your clinic social worker if you have one to identify what's specifically available that's unique to your community. So I'm going to go ahead and take us through those statewide agencies and give you a little bit more information about what each one of them provides. Again, I know some of this may be review for some of us, but I hope it can just be a nice reinforcement. So the Alzheimer's Association. The Alzheimer's Association is a national nonprofit, and they have state or regional chapters. We have a Washington State chapter here. One takeaway is that although it's called the Alzheimer's Association, truly they serve people with cognitive impairment of any type and their families. So not just for people with Alzheimer's. I know that sometimes individuals with memory loss themselves can say, "What? This isn't for me because I don't have Alzheimer's." In fact, the Alzheimer's Association certainly would be happy to serve them. So wanting to make sure folks have that. And then in terms of what they offer, I love for people to know across the board that they have this free 24/7 helpline phone number. It's on your screen, but 1-800-272-3900. That phone number can be called, as you might expect, for a 24/7 helpline any time of day or night. It is free. You can reach a master's level social worker to talk through challenges that are going on with your loved one or for yourself as a caregiver. You can ask what resources are available within your zip code or area. You can get support looking for referrals to those resources. You can process difficult emotion. So it's just a really, really if I'll say at the end, one of my two hopeful takeaways for you all, but one is just hoping that everybody has that Alzheimer's Association website and phone number in their back pocket to be able to hand out to folks that they come across in their clinic or office. Alzheimer's Association also just generally provides really high quality information about dementia. They have many, many, many caregiver support groups across the state, including in person and virtual. So they're a really good resource for that. They also can help set up new caregiver support groups in your area. If you reach out to them, or if you have capacity for somebody on your team to reach out to them to explore that. They do lots of high quality education sessions about a variety of topics around dementia and caregiving that are offered in person, virtual, and they have an online library. If you haven't had a chance to check that out, it's just another thing to let your patients know about. They have just a wonderful library where people can access a variety of different free classes, free workshops, free talks. They also have an online forum called Alls Connect for caregivers, and an online forum for persons with memory loss. And that's a really nice way where people can get online, anonymously send a question out into the interwebs around, what's your experience with memory loss, or what's your experience with caregiving, or where have you turned when this has happened, or what resources have been useful to you? And basically like crowdsourcing, getting that information back from others who are in the same boat. Oops, I did not mean to do that. One second, I accidentally clicked on the website. Okay, next up, definitely want to make sure folks are all aware of their local area agencies on aging, or here in Washington, they're called Community Living Connections. So in our state, there are 13 of these area agencies on aging, and they are dedicated towards serving one or more counties in their area. Their focus is on helping older adults or persons with disabilities and caregivers get the right home and community-based supports and services at the right time. And they have 4 different main focus areas, including they all have some kind of information and assistance office to help people connect to local resources. So again, if this whole talk is about community resources and helping people get connected, these area agencies on aging are all about that. So being able to reach out and provide information on what is available and how to connect. They also do options counseling and assistance to help folks navigate long-term supports and services. They provide some kind of fast track or streamlined eligibility in getting connected with publicly funded programs. And they also provide some support with transitions when people are moving between different settings of care. So definitely want you all, but especially everybody you work with, to know that wherever they live, there is an area agency on aging or community living connections that's dedicated toward providing that kind of information referral service toward community resources. Across the state, there's one free phone number you can call to then be connected to your local office, your local area agency on aging, and that's there on the screen, 1-855-567-0252. You can also online just search for community living connections in Washington, and you can pull up a list of the different regions and which office is for your area. And just briefly, I'll show you kind of how the state is divided up, but you can kind of see with the differing color swatches. Some of the regions are quite large, some are more dedicated to one county, but everybody is covered in one way or another. So we've talked about the Alzheimer's Association and the area agencies on aging or community living connections. Both of those are fantastic sources of community resources and can be accessed throughout the state. The third source I want to talk about is the Dementia Action Collaborative, which supports Project Echo Dementia. So many of you are, I'm sure, already familiar, but this is a public-private partnership that's implementing our own Washington state plan to address Alzheimer's disease and other dementias. As you heard from Lynn Cordy, I think some months back, we updated our plan recently. So we have a new 5-year plan, 2023 to 2028, with lots of great recommendations about how to best be supportive to the growing number of people who live with dementia here in Washington. And throughout time, this group, the Dementia Action Collaborative, has produced a number of high-quality resources for people with dementia and their families. This includes, I'm sure many of you have heard about, the Dementia Roadmap for family caregivers. It's available in English, Spanish, and now Russian. There's also a Dementia Safety Info Kit, Dementia Legal Planning Toolkit, and caregiver tip sheets, among other things. Give you the website there. You can look up the additional resources, but I'll talk briefly about those ones that I listed there. So the Dementia Roadmap This is, if there's one thing that I would make sure I had on hand to hand out to people, it would be this. It's a very, very high quality, streamlined written resource. It's written toward family care partners or family caregivers. And it gives a really nice, simple overview of what to expect throughout the course of all different stages of brain change, from the stage of maybe being kind of worried or wondering about what's going on through early, mid, and late stage dementia. It provides ideas of what can help with those different stages. It gives communication tips, and it has a really wonderful list of resources at the end that are applicable here in Washington. So this was a project that was really spearheaded by a family caregiver, and the dementia roadmaps are really well received by family caregivers. You can order them in bulk for your clinic, and I'll show you how to do that at the end today. Again, I mentioned they're available in English, Spanish, and Russian. The Dementia Safety Info Kit is just another resource to be aware of. This is a really brief written resource. It's just 6 pages, and it's available free online through that Dementia Action Collaborative website. It covers these topics you see here, including how to keep your home safe with a person with dementia at home, preventing falls, how to think through that question of driving and when is it safe to still be driving, or when do you need to be retiring from driving, resources around, or information around wandering, being prepared for emergencies, as well as preventing elder abuse or financial exploitation. So really nice curated list of information on all those different hot topics within safety for people with dementia. Available free. You can just print a number of copies and have them ready and on hand to hand out as needed. The Dementia Action Collaborative also has produced a dementia legal planning toolkit that, again, I'm sure many of you have heard of. But this breaks down, what are all those topics that might come up or that would be important to think about after that diagnosis of dementia or even beforehand, and how to plan ahead for finances, how to plan ahead for healthcare, and what kind of care you want at different stages potentially. So it talks about things like power of attorney for finances or for healthcare, has information on healthcare directive forms and additional resources as well. It gives suggestions on paying for care, kind of who the different professionals could be, you could turn to for those types of questions. These are also available to order in bulk, and they're free. You can order them online. Another really excellent resource and something that people really, really, really appreciate. And then I just wanted to note that the Dementia Action Collaborative also has some lovely caregiver tip sheets. And these are, as it sounds, they're really just like one page front and back tip sheets around a lot of different common topics that can come up, especially for caregivers, communication, driving, getting lost, how to approach keeping your home safe, etc. And they're in a variety of different languages, including currently English, Spanish, Japanese, and Chinese. So those are there online too. If you go to that same Dementia Action Collaborative website, you can find all of these and more. All right, so we did Alzheimer's Association, Area Agencies on Aging, Dementia Action Collaborative. Now I'd like to talk with you about Dementia Seattle as another source for resources in your community. Dementia Seattle is something special to our state. It's a Seattle-based, but has grown beyond Seattle to be kind of Puget Sound and even beyond. The focus is on empowering people with memory loss and their families to remain connected and active in the community. And the way that the approach is through organizing community events that are tailored to people with memory loss and their families that take place in vibrant public settings. So for example, things like memory cafe, social meetup events in coffee shops, libraries, or senior centers, walking groups happening in parks, neighborhoods, or a zoo, even here in Seattle. Art gallery tours in museums, improv workshops in theaters, a lot of things having to do with social engagement, physical activity, creative engagement, community service, and again, making use of the different public spaces within a community that are meant to be welcoming and accessible to people across the board, but are kind of doing their part to be more inclusive to people with dementia. This model is something that has gotten national recognition, and I think I like to just emphasize how lucky we are here within Washington to have a lot of social engagement opportunities, more so than other areas for people with dementia. And there's also resources if you go, sorry, let me back up. If you go to the website, mementiaseattle.org, you can see a community calendar that lists out day by day what kind of events are happening when. Is there a walking group? Is there an arts workshop, etc.? There's also resources on how to approach starting up a new program in your own area. So that's available as well. Just to give you an example, if you haven't maybe attended one of these types of programs before, the most basic one of these kind of community-based events is the Memory Cafe, which I mentioned that term already, but a Memory Cafe, also called Alzheimer Cafe, is an informal social meetup in a community space like a coffee shop, restaurant, library, faith community senior center, YMCA, local Kiwanis Club, etc. And they're free. They're usually once a month. Oftentimes there's some kind of food involved. Sometimes there's also some kind of structured activity like a sing-along or an arts project or something like that. The true focus and purpose is simply to pull people out of isolation and give them that sense of social connection, being able to be together with others who understand their experience, but where the focus isn't necessarily on, talking all about dementia, but it's just a place to enjoy and be together. And this model we locally with the Dementia Action Collaborative created a how-to guide on how to start this type of program. It's actually a pretty easy program to start up. It's just literally organizing a party once a month. And you can find a toolkit if you or somebody in your team or a partner organization wants to look into how do you start up one of these programs. You can Google Dementia Action Collaborative, Alzheimer Cafe model. You can find the online toolkit to look into how you can start one of those if there's not already one in your area. They, we had over 20 of these meeting monthly in Washington before the pandemic. Then things kind of shut down. And now we're seeing a resurgence of memory cafes around the state again. And this is just, I pulled some examples of ones happening currently, like the Federal Way Library has a memory cafe first Friday of every month. There's a church in Oak Harbor that's hosting a memory cafe. This is a memory cafe sponsored by the YMCA, North Shore YMCA, and they do it at McMinimans Anderson School. So a lot of community-based organizations can set these up, and they can happen in lots of different types of public settings. I think it can be easy to hear like, oh, social meetup, how meaningful is that? Or, what is that really doing? Is that curing somebody's dementia? Yeah, it's not necessarily curing somebody's dementia, but I like this quote from a woman named Mary with dementia here in Seattle, but she says, at one point, my doctor told me, stay active and stay social. That's the best advice I've gotten anywhere. And I think for many people, it's challenging enough to deal with some of the symptoms of memory loss or dementia, but on top of that, that challenge of also being socially isolated and potentially feeling ashamed of being out and about, or wondering how will people feel or how will people react to me if I forget things, can be very, very painful. And so I think these types of opportunities that are welcoming, inclusive, tailored toward people's strengths and give them that sense that they can be out and about connecting with others is so vital. All right. And then the last of the sources of community resource, I want to mention just in brief, the Memory Hub, which is operated by the UW Memory and Brain Wellness Center with 5 collaborating organizations. It's a community center that focuses on helping people with memory loss and their families thrive. It's on Seattle's First Hill, so nearby Harborview Medical Center, and it offers in-person, virtual, and statewide outreach programs. We're open to the public 3 days a week, as you can see. And I want to just note, here's our collaborators, the UW Memory and Brain Wellness Center, Fright Art Museum, Alzheimer's Association, Full Life Care, and otherwise all offer key programming on site. And some of the programs and resources I'd like to highlight include those ones that are available across the state because they're online. So we have a program offered by the UW Memory and Brain Wellness Center at the Memory Hub called Memory Loss, A Guide to Next Steps. This is a once a month orientation for people recently diagnosed with memory loss or dementia. It was designed in partnership with people with dementia, and it goes through some of the key, foundational types of information, education. But the secret to it is that there are always two peer mentors who live with memory loss, who volunteer their time to share from their own experience and help others kind of move forward on their path with dementia. So this is something that's available. People can sign up for through Zoom. We also do it in person, and it includes a guidebook with it, Living with Memory Loss, a basic guide. There's also weekly, what are called coffee chats online. It's a social group for people with memory loss, and weekly caregiver forums, which are for caregivers to get support. Both of those are something where people can come as often as they like, but it's available every week. And then in terms of in-person opportunities, if folks are able to make it to the Seattle area, there is a Memory Navigator program, which are one-on-one appointments with an Alzheimer's Association social worker to talk through resources. There's an adult day program offered by Elderwise, and there's a wonderful memory loss resource library, as well as an art gallery of art made by people with dementia, and a public memory garden, which is open during our open hours. So feel free to check it out more, or to tell folks about it if you think there would be interest. All right, I'm going to pause. And one of the signature statewide outreach programs that the Memory Hub offers is called Dementia Friends. And actually the program manager for it is here today, and her name's Katie. Katie, would you mind just sharing a little snapshot of that?
Absolutely. Thank you so much, Marigrace. So Dementia Friends is a global movement that is changing the way people think, act, and talk about dementia. Currently, we're operating in 24 counties in Washington State, and we are led by the University of Washington Brain Wellness Center. We do a train the trainer model, so we have community volunteers who are trained to offer 60-minute information sessions out in the community that anybody is welcome to attend. These sessions just talk about really basic things about dementia, how to communicate with somebody who's living with dementia, and then we talk about ways to take action and share about local, state, and nationwide resources and support. So if you'd like to learn more, our website is listed there. And if you have any questions, you're welcome to contact me. I'd be happy to share more about the program. Thank you, Marigrace.
Thanks, Katie. All right, so we kind of ran through a lot of information around types of community resources people might be looking for, or that might be available in their area. 5 different organizations or agencies that can be sources of those community resources around the state. And I want to leave us just with, you're feeling like, well, if I was going to do one thing out of all this? It can feel very daunting to become familiar with all the resources that are out there, or try and get a million different brochures or flyers about all these different things. But I would say, if you want to take just one step, I absolutely recommend ordering a set, or as many as possible, of those dementia roadmaps for your clinic or office. And you can do that online through the state of Washington here at this website. There is a small cost, but they're currently 37 cents each when you order 100 or more. And they're a very significant publication. So I think it's very low cost. Or if you don't want to go that route, but if you just want one organization to make sure you mention or get in those after visit summary notes to patients, just making sure to tell your patients about the Alzheimer's Association, that they're a free service to folks with dementia of any type, that they have a website with great information, and that they have that 1-800 24/7 helpline that people can call any time of day or night and talk to a master's level social worker. So those would be my recommendations. And we have a little bit of time for questions. Thank you so much for your attention.
Wow, Marigrace, thank you so much for this outstanding overview of the resources, and also for all that you do in the community for people living with cognitive challenges and their care partners. We're so fortunate to have you as a member of this community today. So does anyone else have any questions for Mary? Or, well, yeah, does anyone have any questions? I'll open it up first. Feel free to unmute yourself or put a question in the chat. Maybe stop the share, Mary. We can.
Oh, sorry.
No worries. Thank you. And if not, oh, here's a question, Trang.
Thank you for a great overview. Did I hear 37 cents each if you order 100?
Right.
Oh, that's pretty cheap.
Right. I know, that's what I thought.
Very good value for that roadmap. So I'm going to pose a question to the community, and if you want to put it in the chat, please do. But what resources have you used or programs have you accessed? And maybe if you'd like to share a story about that experience with your patients and your community. How about a show of hands of how many of you use the roadmap in your clinic? So anyone who's using it want to have a personal story about that? How can we have, let's see. Rhonda, did you want to?
Yeah, I can share.
Great.
So I work at Kittitas Valley Healthcare in Ellensburg, Washington. So we're obviously rural part of the state. We use it a lot with our home health patients and our hospice patients and their families. I think it's just got such a nice progression of what a family can expect and the changes that they can expect to see in their loved one. And I enjoy being able to share tips and tricks on how to communicate with them as they go through the various stages. So I think it's a wonderful publication. And thank you to everyone who may have helped in putting it together and making it available to us.
Thank you, Rhonda, for sharing. Yeah, and it's it's in paper and folks can go back and look at it again and access the resources and kind of take it home in their hands. And I'm new in the area, but the resources were very valuable. Thank you, Esther. Is there anyone in particular that has been helpful that you want to share with us about? Reza, did you want to, I see your question. I'm wondering if you could, how can we have one body of dementia care in the Seattle area, Evergreen, Overlake, Swedish, and University of Washington? Do you want to unmute yourself and clarify what you're pointing towards? And if you can't, you can put it in the chat, or maybe I can try to understand. I feel like this, Project Echo, dementia, and the work of the DAC and cognition and primary care are sort of, if you will, a joining of hands of people coming together to try to build capacity and understanding and services and community for people living with cognitive challenges and their beloved care partners in communities. And are you able to unmute yourself? Did you?
Yes, I'm at the airport actually.
So
So, I see many different activities, and when you were working with us at Evergreen, that was a blessing for us. Right? We always appreciate what you did for geriatric care and increasing our knowledge about memory care. But I see there are many different hospitals, neurologists, geriatricians, even primary care doctors. They do memory care, but it's very scattered. Nobody communicates with each other and share the information. And I really enjoy this meetings, this kind of education for me. But I don't know how we can have one body of the caring for memory care. For example, at Evergreen, I see a patient, or just a patient, and the patient goes to the University of Washington. I used to send my patients to you. I don't know where you are now. I happy to send some of them again. So, that's a challenge for us.
Mhm.
And, and most of the time they get the same answer. But if you have one body, one group of the memory care physicians, and say, for example, in Washington State or in Seattle area,
Yeah.
with and like this meeting we have, we can share the information with each other. So I think that would be very effective, and the patient have it like a file for everywhere. I mean, if I see a patient in Evergreen, I send it to you by having the EPIC. So it's a very good communications, but again, it's very hard to just, it's a challenge for everybody. So.
Yeah, no, thank you so much for sharing that and for also prioritizing this as you're en route. Thanks, Mary. Thank you. Round of applause for Mary, and then I'll thank you so much. Really bowing in gratitude for all you do. Amazing.
Thank you. I appreciate being
Impact,
here.
everything.
Off to another meeting, but thank you for what you all do every day.
Okay. I mean, I think that what, Reza is talking about really is this enormous need, this growing need. How can we continue to serve people living with cognitive challenges together? And how can we make, create a standard of care aspirationally throughout the state, perhaps WWAMI region, even more broadly. And so I do think that there are these ongoing efforts. And as I mentioned, Brock, do you want to speak briefly about your efforts in cognition and primary care? Brock is going to give a talk. Dr. Gaster has been really innovative in this area in primary care, and he's going to give a talk. Is it in June? I think it's in June.
I don't remember.
Yeah, that's okay. Do you want to just kind of address this? Because it is it's an enormous problem, and we are in a number of ways trying to build this capacity to address, this growing need.
Yeah, I mean, I see it as, there's like at least 4 legs of the stool, and we need all 4 of them. And and so one of them is for sure primary care. Needs more education and more confidence and more skill and doing cognitive evaluation and helping patients and families. But then, we also need more specialist capacity too, because there's definitely situations where patient and or family and or PCP feel like they need sort of more sort of expert guidance, which will sort of often be like a neurologist or a geriatrician. And I think we, have for years wished that we had more geriatricians and that, doesn't seem like it's coming down the pike necessarily in terms of the sort of training pipeline. And so I really do think like the giving education and confidence and sort of like building capacity among general neurologists is like also like really, really important to sort of highlight, that that we just need more. And because there can't be just like one place or 2 places or even 3 places in the entire state where people can go to get sort of expert neurological care for cognitive conditions. And then just like the 4th is just like the sort of care provider, sort of general sort of social work / sort of kind of quality of life improvement, sort of like resource care providing. I definitely think of that as sort of equally important from a care provision standpoint. And we need more. and I in some ways I sort of like consider part of that is geriatric psychiatry as you know, just like the enormous need for support when people are developing severe, you know, behavioral agitation type of symptoms where you know, it's often outside the scope of what primary care can provide. It's often outside the scope what a neurologist can provide. You know, it's going to be, you know, at its root, sort of non-pharmacologic approaches to help with symptoms like that, but sometimes pharmacologic sort of assistance is needed, and we're just like so, you know, badly in need of that capacity as well.
Thank you. Michelle, did you want to add anything from Ripple in terms of what you guys are aspiring to do as well?
Sure, absolutely. I'm Michelle. I'm the new clinical trainer with Ripple. We provide virtual care navigator support for families, caregivers, and patients. And we are currently in Washington State, and we do some work in facilities. We have nurse practitioners with a specialty background in dementia care as well, to support the care in those facilities. We also work with Optum across the state to be able to provide that virtual care navigation support for patients and families as well.
And in partnership with
Feel free to check our website.
and in partnership with the Alzheimer's Association.
Yes, that is our brand new last week excitement. We launched a partnership with the Alzheimer's Association, and have approval for participation in the guide, and that is a CMS initiative to be able to provide support more expansively to Medicare beneficiaries. That is a in the works development, but the Alzheimer's Association partnership is very exciting for us to be able to collaborate and partner with them across Washington and other states as we launch as well.
Thank you, Michelle.
Yeah.
Before I come back to you, Brock, I'm curious, Joan, I don't know if you can unmute yourself and share a bit about the programs at Elder Place, which are so phenomenal, and I wish we had more of those. You may not be available to. Okay, we can. Brock?
Yeah, I was the question about sort of like general neurology is something I feel like I wish I knew more about. And I kind of have a sense of what the sort of the Seattle area lay of the land is. But like Sylvia, I'm wondering if you could sort of say like what are things like in Spokane in terms of are you the only neurologist there offering cognitive specialty care? Are there others in your neighborhood?
Yeah, I'm basically the only main person. Many neurologists, for example, there is a big group in Kootenai County with Kootenai Health, which is right across the border in Idaho. And despite a lot of neurologists, even general neurologists and general NPs, they will plainly refuse any memory problem. And so that's obviously a big deal. Sometimes there is some neurologists in the southern part of Washington, like Yakima, that will try to do something with it. But now that I'm here, they're like, oh, she can't see them. So that's the problem. And we don't have general neurologists here within Providence. They're kind of all subspecialized. The person that gives me the most help is the movement disorder specialist, who is really trying his very best. What I do for my part is if one of my patients has some general neurology problem, I address it because I'm still a neurologist, unless it's like beyond my scope or it's too, advanced. But yes, we really need general neurologists because it could cut off, at least a good proportion of people, at least trying to do the basics of addressing the precipitating factors, working with the PCP to improve polypharmacy and all of that, and then kind of therefore kind of funnel all the major cases to me, but it's really hard to do.
Yeah, I mean, I just feel like that's like such a unspoken kind of issue. Like there's so much, everybody's always talking about, oh, we need more primary care capacity, more primary care capacity. What about the primary care workforce? And I'm just I think it's really only with the issue of lecanemab has it even really kind of even come to my attention how many sort of general neurologists, or how few, I guess, how few general neurologists there are, or people who will kind of call themselves a general neurologist, except for cognitive care, which is like just so sort of like, bizarre. Like it's people kind of like, primary care, how can you turn your back on sort of cognitive impairment? It just like feels even more kind of like shocking of like general neurology. How can you turn your back on cognitive sort of impairment? Yeah.
Yeah, I think the reason is in part to do with the timing. If you have a 20-minute visit, you're not gonna even get the patient to sit down and be oriented as to where they are. And so I've had to put my foot down here to say, I can't do things in the allotted time. I need an hour and 15 minutes because I'm by myself. And that works better. But I cannot think that if all the neurologists did that, it's kind of impossible. And sometimes it takes less time. But for the more advanced patients where they start crying by the first 15 minutes, what are you going to do? Okay, let's do the MOCA now. So it's really hard. And the other part of it is that, much of this time doesn't get seen into RVUs, no matter what you do. Some of it does. If you have a longer visit, obviously it will count. But just speaking of practical terms, which is what most hospital administrators want to hear, they are not going to see the work that you put in because they have on the other side, an EMG neurologist that can kind of make RVUs rain in a relatively short amount of time. And so it would be nice to have this as a specific area, like when you do a procedure in your practice, you're getting billed more, Whereas when we have to do the MOCA, and sometimes you have to take your sweet time doing it, unless you spend 30 minutes doing a cognitive test, it's not going to get really valued as much, So I think that's the limitation for most people, that if we had more time and it were built into the schedules, then we would do it. But I did put my foot down and it's helped me.
Good.
I encourage everybody who is interested to do the same for at least like one day a week if you're going to see cognitive people and just say, I'm going to take my time.
Yeah. Yeah, I mean, it's a problem across the board, whether it's in specialty care, whether it's in primary care, that these are really complex and challenging situations that require a lot of time. They require training for the confidence and the competence. They probably require that team, as we know, with a social worker, or at least linking to these programs and services. So, and we all have to take, yes, we can't just keep pointing towards primary care. Of course, we also have to engage our colleagues in general neurology, that this is a really growing and unmet need that needs to be better addressed by neurology as well, for sure. And I mean, our care model has to change, right? Because if it's pure RVU driven, the incentives are all wrong, and people won't prioritize the care. They can't afford to. So without the system level support or policy change or value-based care, I mean, for all these reasons, I'm glad, Sylvia, that you really advocated for that time. I hope you can build out the team. You clearly have the training, and then can we help support people with like IT, like templates and other technologies that would, and you've had an interesting idea, Barack, about this, like pulmonary function tests, like a lab that could serve, whether virtually or in person, to really have that skill set for cognitive assessment. We're not there yet, but that may be something, another component of the care team ultimately, right? Did you want to, you have your hand up, do you want to?
Yeah, I mean, I'm glad you brought that up, because I think, just like the other, it's like, I'm so glad that Reza brought this up, of just like, what is our capacity and how can we kind of build it up and work together? Because I mean, because like of all the things that we've talked about, like we still haven't even really gotten to sort of neuropsychologist, like how do you, neuropsychological evaluation, which is, maybe even harder to come by than a geriatric psychiatrist, and so like, but sometimes you like really, really need neuropsychological evaluation. You need more than a MoCA test, and how do you get that, and where do you get that, and I think we really do need to be sort of like acknowledging this like big giant sort of like gap that we have in not just care, but just like evaluation. I think we are absolutely under resourced to give people the evaluation that many people need, and that we just need we've got to figure out a way to find something that's just sort of like higher volume, more throughput, more capacity to do, an evaluation that is more than a MoCA, but maybe less than a 2-hour neuropsychological evaluation, just something that you can sort of like schedule people in 30-minute sort of on a 30-minute schedule, and and so that a general neurologist could send somebody to get sort of rapid testing, and then come back and sort of review the results, so that it's all not sort of like stuck on sort of like got to fit it into this 30-minute appointment or 20-minute appointment. Just doesn't seem reasonable. Cognitive function testing lab. That's what we need.
That's really sensitive to culture and language,
Right, and hearing and
dimensions, and hearing and vision,
and
yeah,
absolutely,
right.
just like all the thing. And
Right.
there's like so many like devices that people are like, oh, we can do this from people's home
By phone.
or by phone, and like that's like not what we need. We
No.
need something that's like standardized, that's like
Validated.
validated. It's like in a sort of quiet sort of like place where somebody is like seeing that they're sort of doing it correctly. Like that's my vision. I'm so glad you brought it up, Reza, because I'm always excited to sort of share my vision about that.
Well, the sun did just come out. We have veered a bit from programs and services. So I'm going to just open the floor if there's anything else that people want to speak about or ask a question about. And if not, we may have the opportunity to access that rare gift of time, that precious gift. Right. So if you're University of Washington, you can just text that number 8574. And otherwise, we gotcha for CME. And next session, is by Dr. Brock Gaster, member on advanced care planning. Fantastic. Thank you. And please do complete that 1-minute post-session survey. All righty. Thank you.